This week we are talking about interventional procedures that deal with the abdomen area. So let's review the abdominal aorta anatomy. So the abdominal aorta is considered from the diaphragm to the bifurcation. And the aorta bifurcates, excuse me, into the right and left common iliac arteries at about L4, L5. So about here is where L4, L5 is where the aorta bifurcates into the right and left common iliac arteries. The first ventral branch off the abdominal aorta is the celiac artery, and that artery trifurcates. So you can see there's three little vessels coming off of that. So this one would be the hepatic, which goes to the liver. Then you have the splenic, and then you have the left gastric. So that is the celiac trunk or celiac artery or celiac axis. You'll hear it called all of those things. And like I said, it's just a short segment that comes off the anterior aorta, and it trifurcates into these three arteries. Below the celiac artery is the superior mesenteric. Below the superior mesenteric then are the right and left renals, which are lateral branches, and then below the renals is the inferior mesenteric. Then of course it bifurcates into the right and left common iliacs, goes a little ways down till it bifurcates into the external and internal iliac, and then the external iliac courses further down. Here's an angiogram showing the abdominal aorta, and right away you can point out the right and left renal arteries because they are lateral branches. So you know that just slightly above that is the superior mesenteric, and then above that is going to be your celiac axis with the three branches coming off. Below the renals then is the inferior mesenteric, and then at about L4, L5 is where it bifurcates into the right and left common iliac arteries. So here again we've got the distal aorta bifurcates into the right and left common iliac arteries. Then it bifurcates into external and internal iliac. Now this external iliac continues on down, and as it crosses the femoral head, it now becomes the common femoral artery. And then from the common femoral, it bifurcates into deep femoral or profundus and superficial femoral down here. So what we've talked about so far are the bigger vessels that come off the aorta. Of course, it can't be that simple though. There are some other small ones that exist, and we need to know about a few of those. Specifically the gonadal artery. And so the gonadal arteries, there's a right and a left one, and if it's a female patient, the gonadal artery will supply blood to the ovaries, and if it's a male patient, the gonadal arteries will supply blood to the testicles. So this gonadal artery is a small vessel. It's just above the inferior mesenteric artery, and it comes off kind of anteriorly, but also a little bit laterally also, so it's just kind of small and doesn't come, comes off kind of at an angle. Here's a better look at the celiac artery. So again, the celiac artery is here, and it trifurcates into the hepatic artery. This one is showing, this is the left gastric, and then this is the splenic artery. Here is a better view of the superior mesenteric artery. Oops, sorry. So again, it's not necessary that you know all of these little branches. You just need to know where the superior mesenteric artery comes off the aorta at, and then you need to just have a general idea of the structures that it supplies, meaning the small intestine and large intestine. Okay, same thing here. This is the inferior mesenteric artery. And again, you don't need to know all of these little branches and their names. The main thing to know is just where the inferior mesenteric artery comes off of the aorta, and then just to have a general idea of what it supplies, which is the colon. Okay, this is a better view of the internal iliac artery. And so again, here we've got the aorta, we've got the inferior mesenteric artery coming off here. It bifurcates into the right and left iliacs, and then not too far down it bifurcates into external iliac and internal iliac. So again, it's not necessary to memorize all of these branches off the internal iliac. The main thing to understand is just to know where the internal iliac is, and you need to just have a general idea of what it supplies. It supplies the blood to all of the structures in the pelvis. For instance, the bladder and rectum. The female patients, it gives off the uterine artery for the uterus. In the male patients, it supplies blood to the prostate gland. So again, you don't need to know all of these little bitty branch names. You just need to know that the internal iliac artery supplies all of the structures that are within the pelvis. Okay, the portal circulation. So when we swallow food and water, it of course travels down the esophagus and into the stomach, and then traverses the small and large intestine. And while that food and water is in the small and large intestine, it gets broken down into smaller pieces, and then it gets absorbed into the bloodstream. So as you can see, all of these veins coming from these digestive organs, they all merge. Okay, so here you've got the superior mesenteric vein. Here you've got the inferior mesenteric vein. Here you have the splenic vein, the gastric vein. All of these veins all come together and they merge into the portal vein. So this is important, portal vein. And so all of that blood is, kind of nasty. It's got all of the stuff that we've ate and drank in it. And so it goes through a separate or an extra filtration system called the liver. So all of this blood in the portal vein, all this blood merges and meets up in the portal vein and then enters the liver via the portal vein. So then that blood gets filtered by the liver, then it exits the liver via the hepatic vein and then goes to the inferior vena cava. So and all of this collectively is called the portal circulation. And it's a venous system, blood coming from all of the abdominal organs and digestive organs going into the liver to be filtered before it goes to the inferior vena cava.